All right, repeat it. Good evening, everyone. This is the Human Relations Commission for the City of Adrian, and we are opening our meeting at this time. Our pre-meeting is a study session and it's open to the public. We are asking those that would like to speak later under public comments. You will be able to have 5 minutes to do so. At this time, we're going to have the roll call and we're going to ask our secretary for tonight to do that.
Mayor Sword Heath, Commissioner Bernard,
Present.
Commissioner Ramos,
Present.
Commissioner Patton, Commissioner Cavazos Frank, present, Commissioner Boone,
Present.
Commissioner Barron, Commissioner Carter, Commissioner Harbat.
Present. At this time, we would just say that Commissioner Carter and also Commissioner Barron and Frank, and Patton are excused absences. The president, the mayor will be coming forth shortly. So those were the ones absent at this time. So we will be voting on our minutes. Everyone received their minutes in the 7 o'clock meeting. And our treasurer's report, if you like to give us an update in the 7 o'clock meeting, we can do it then.
Okay.
Okay, because we have a speaker today that's going to come and speak to us under the old business discussion for our town hall meeting. And so we've invited our Lenawee County Commissioner, Director from the Health Department to be present with us, along with the Community Action Agency, and I'm hoping that they are there. And also, we're asking representative from the housing help to be with us today. So at this time, we're going to open up for our Lenawee County Health Department, Martha Hall, if she's there, to turn on her phone. And we just like to say welcome today to our meeting. And we'd like you to give us some information about what's going on with not only COVID, but what's going on in the Lenawee County Health Department, and any questions that we may have, if you could answer, or you just give us an update on things. And thank you for coming.
Absolutely. Thank you for asking me to be here with you. Can I share my screen?
Yes, you can.
All right. Well, let me do that. And maybe that'll, it says it's disabled. The screen sharing is disabled for participants.
You should be okay now.
Try it again.
All right. There we go. Good old technology.
Yes.
So are you seeing a screen that has a slide presentation on it?
Yes, we do. We
Okay,
see
perfect.
COVID-19.
All right, great. Just making sure that, because that's not what I'm seeing on my side. So, all right. So I'm going to just start here from the beginning. And so the COVID-19, so the pandemic, we had our first case of COVID-19 identified in Lenawee County on March 24th of 2020. So we're quickly approaching 2 full years, and it certainly seems like every bit of that. I'm sure not just for us here at the health department, but I think everyone is feeling that. And so really what I was hoping tonight is just to be able to share some information. When we spoke the other day, one of the things that we talked about was, it's important for people to know where to find information. And so I provided just a couple of those resources here. So the Centers for Disease Control and Prevention, or CDC as it's commonly known, you can go there and find information about travel, information for maybe how to host different kinds of gatherings. There's also information there. There's so many things, but just as far as COVID related, the travel piece is really important, especially as we're approaching that, the holiday season and more people are thinking about traveling to visit loved ones. Michigan Department of Health and Human Services, there's a lot of great information there for the state of Michigan. So case data that is for the entire state and then also for each county. There's also a really nice thing that they do there. Every week they do a slide presentation. It's called Data and Modeling Weekly Update. And there's a lot of great information that is shared there. It's everything from what are they seeing right now and what are they predicting things to look like over the coming weeks, looking at different models. Also vaccination data statewide and also for each county. The nice thing on with the vaccination data is that you can go in and not only look at, so you can see that on the screen here, I have that Lenawee County is 50.67% of our individuals age 12 and older are fully vaccinated. But you can go in and look at it by different age groups also, which is very interesting. So whether we're looking at our younger population or the older population, you'll see that there's a pretty significant difference in vaccination rates. So lots of good information there. And then a couple of other sites that I included, the health department website. We provide information specifically for Lenawee County. So case information, so how many COVID cases, what are the hospitalizations, and we provide that information Monday through Friday. Also information on where can you get vaccinated in Lenawee County. So making sure that that information is available, and then testing information for Lenawee County. It's really critical that as many of our residents are vaccinated as possible. And it's also really important that individuals are being tested if they have symptoms or if they've had an exposure, a known exposure. So those are some good pieces of information to make everyone aware of. And then the last resource that I have listed is the mystartmap.info. You can go to that site and, we hear people talk about transmission levels. And this is where you can go and see what does the transmission level look like for the entire state of Michigan? What does it look for each region within Michigan? And then also, how does it look county by county? So those are just a few of the resources that I wanted to make you aware of. There are other really great sites. The John Hopkins has a nice site that they have certainly developed further throughout the pandemic. But this is just to give you an idea of some of those places where you can get some good information. And then what are things that all of us can do to help prevent the spread of COVID? I already mentioned vaccination. I would really just encourage everyone, if you haven't been vaccinated yet, if you have concerns about being vaccinated, please talk to your healthcare provider, talk to a pharmacist, talk to us here at the health department, because if you are able to be vaccinated, it is just so important that everyone does that who is able to. Wearing a mask when we're in indoor public spaces. The CDC has recommended since the summer that for areas that were experiencing either substantial or high transmission of COVID, that everyone should mask up when they're in indoor public spaces. We are at high transmission and have been at a high transmission for several weeks. So just really important for all of us to remember to do that when we're in public spaces, indoors. Staying home if we're sick. You know, it's so easy to think, oh, you know, it's allergies, or, you know, I have a little cold, or, but we really don't know that that's what we have unless we get tested. So just really encourage everyone to please stay home if you are sick. If you have symptoms of COVID, please get tested. Or if you've been exposed to someone that is that was COVID positive, get tested also. And that's regardless of vaccination status. We would still encourage everyone to get tested, even if you have been fully vaccinated. Avoiding crowded indoor spaces. If there is a way for us to not be in a crowded indoor space, I would certainly encourage you not to. Making sure that we're washing our hands frequently. And, you know, as we start thinking about, you know, moving towards indoors, I'm an outdoor person, so that this is not my favorite time of year when we start spending more time inside. But, you know, thinking about increasing ventilation when we are indoors. So, you know, especially if we're going to be having people in our home that don't live in our home, you know, if there's ways to be able to increase the ventilation. So, you know, opening the windows a little bit, opening some doors, just to keep some air moving through and keep exchanging that fresh air. You know, some of the buildings have done that with their heating and air conditioning systems. You know, they have been able to increase that ventilation, and I don't know how readily available that is for someone to do that in their home. But some of our more commercial type buildings have done that. And, you know, we would certainly encourage that, because bringing in the fresh air and exchanging that air is very important. And then just one other consideration, you know, also just thinking about the fact that, you know, we're moving towards the holiday season, and, you know, people want to be able to travel oftentimes for the holidays. I would just encourage everybody, make sure that you know what the requirements are for your destination. There are some destinations that require vaccination. There are some destinations that require testing within so many hours of leaving your home, or before boarding the plane, I should say, or boarding some type of transportation. And some places do require that individuals quarantine upon arrival if they are not vaccinated, if they're not fully vaccinated. So just make sure that you know what the requirements are for wherever you're going, so that you don't have any surprises in store. And then masks are required on all public transportation. So whether we're taking an airplane, you know, a train, a bus, what have you, masks are required on public transportation. And then certainly having extra masks and hand sanitizer and wipes available are also going to be really important to, you know, just to make sure that you're properly equipped, you know, for any kind of travel that you might choose to do. So that's what I have, and I'm going to stop sharing my screen.
That's wonderful. We really got quite a few pointers and good ideas, and most of us, I think, are doing that. As you can see, we're wearing our masks as we are not speaking, and we're just happy to be able to get this information. Now, do any of us have any questions that we'd like to ask our director?
Yes, Martha, this is one of the sisters from the Mother House. I know we keep pretty, you know, close tabs on all of this with you all. And we just keep noticing that the percentage here in Lenawee County is so high and rises almost every day. I know it's up to 17.4 today. What is the explanation for that?
I don't know that there's any single reason that we're seeing more or seeing that higher percent positivity. So the percentage of tests that are coming back positive, we are seeing that number has increased. And it's been up there for at least the last few weeks, definitely much higher than what we would like for it to be. But, again, I would just really encourage everyone that if you have any kind of symptoms, and, we all know that with COVID, the symptoms aren't the same for each person. It is so different. And so, I know that many times this fall, I've talked to people that said, I thought I just had allergies. I thought it was my allergies. I always get allergies this time of year. And then they ended up, getting tested because then it started feeling different. So please, don't assume that it's allergies. And I'm sure that hasn't helped our situation. And as we continue to have the cold weather and we start moving indoors, we're going to, my concern is that we're going to see more cases. So I would just really encourage everybody to, the things that I've already shared, just as far as avoiding crowded spaces and trying to, make sure that we're wearing a mask. The mask is the masks are a good thing. So if we can wear those when we're indoors in the public, that's certainly going to help. If we happen to have a situation where someone, maybe you feel just fine today, and then 2 days from now, you end up starting to feel sick. Well, you're symptomatic for 2 days before those symptoms start. So just all of those things combined, it makes it very easy for it to spread. So we just all have to be on our guard as much as possible. And, with regard to vaccination, if anybody, for the individuals that have been vaccinated, please share with people that, are in your circle, maybe family, friends, share with them that, what your experience was. And I think that does help it helps people to then feel more comfortable. And like I said, if individuals have questions, please reach out to somebody that can, really provide them with some good information on vaccination.
Anyone else have any questions? I have one. I'd like to know about the days of quarantine. They're saying, some say 10 days, some say 14 days. What is the CDC or the state of Michigan saying is best for us to do in terms of days of quarantine? And how long are we contagious?
All right, so we'll take those separate. Let's start with how long we're contagious. Let's start at the beginning. Well, I guess, or depending on how you're looking at it, it could be the full circle there. But as far as how long we're contagious, it is starting 2 days before you start to show symptoms, or if you're somebody that doesn't have symptoms, then we start with the day that you're tested. And we tell someone that they can return to normal activities after testing positive if it has been at least 10 days, 10 days from the day they started with symptoms, or 10 days of the date of their test. And then their symptoms are improving and they haven't had a fever for at least 24 hours. So that's the timeline on how long you're contagious, and how long you should not be engaging with others. And then for individuals that are exposed, that would be the situation where you would quarantine. And for them, They're looking at, so the standard quarantine is 14 days. That's the standard. And that's based on the fact that the incubation period for the COVID virus is 2 to 14 days. But what we know is that most people get sick within that first 10 days. So we have been using the 10-day quarantine, actual quarantine period, and then asking individuals to monitor for symptoms for the days 11 through 14. And if they were to start showing symptoms to, immediately isolate.
Excellent, excellent.
Did that make sense, or do you need me to clarify anything? Because I know that's confusing.
I think it's pretty clear. Does anyone else have any questions about the timeline? I think a lot of people were saying I can come out if I had COVID after 10 days. And what I'm hearing you say that it's 14 days maybe if you have no symptoms or you haven't had a fever, because sometimes, people have fever later in the quarantine time. How long does it take to really know that you have COVID if you're not tested?
Well, the way that you're going to definitively know would be to be tested. Certainly a doctor could diagnose based on symptoms. But I do want to just be clear though. So when we're talking about someone who is COVID positive, they can return to activities if their symptoms have improved, they haven't had a fever for at least 24 hours, and it's been at least 10 days. So for someone that is COVID positive, so whether they have symptoms or not, that's when they can resume normal activities. And then the 14 days comes in for quarantine. And so that's someone who's been exposed to somebody that is COVID positive.
I know there's a lot of people that don't know that they've been exposed. If you've been in a group where somebody identifies, because a lot of people are not saying that they actually have been exposed. And so you don't always know if you've been exposed to quarantine.
Yeah, if someone, and we encourage people to please provide their close contacts. But we also fully realize that probably doesn't happen all of the time. I have heard of situations where people will notify someone, maybe they contact them personally and tell them, but they don't necessarily want to share that with the health department. But if someone tells you that, you were around them and it's a time when they would have been infectious or contagious, then I would encourage you to, like I said, for quarantine, as long as the person doesn't have, as long as that close contact doesn't have any symptoms currently, they should stay away from other people for 10 days and then monitor for symptoms for 4 more days if they were exposed.
Excellent.
And one of the things I should point out, on the health department website, there's a quarantine and an isolation calculator on the website. So it gives some scenarios, and you can actually plug in the date that you were a close contact to someone, and it'll give you the information of when you can resume normal activities. There's also some prevention pieces there that specifically talk about, what is isolation? What is quarantine? When can I resume normal activities? So there's really a lot of really good information there if you click through those tabs.
So another question that has come to my attention was when students are exposed to someone that has COVID in school, they're suggesting that some of the students stay in school if they're not feeling any symptoms, or they're suggesting that they quarantine. So it depends on the school and it depends on the age. And so I really wanted to know what is the actual good practice that we should do.
Well, so the process that's established, and that this is something else that's on the website. You'll see there's a school guidance document. And that's the document that, we have used to communicate the process and with the schools. So typically what happens is the schools, if they have a COVID positive individual at the school, they're going to be in the best position to do that contact tracing. They have seating charts. They know, who somebody sits next to in class. They know who's on the sports teams, those kinds of things. So they would provide that information to the health department. They know what, we provide them with the parameters to use, and they would identify those close contacts. And then the health department sends the notice to the parents of the need to quarantine and when the student can return.
Any other questions? Okay, I guess I have another one. The other question that I have is the CDC or some of the scientists were studying and trying to see whether they're going to have a vaccination for the younger kids, and that's age 5. I'm not sure if they passed it or not today, but I wondered, when do they notify you that it's okay to vaccinate 5 and up?
So they did meet today, and so it's really important. One of the things that we don't always hear when we hear the announcements about the fact that these meetings are taking place is that it's a process. And so it's not just one meeting, it's not just one group that meets. So there was a group that was meeting today, and I believe they're meeting tomorrow also. And then there's another meeting that is scheduled for next week, I believe, with FDA. So this, over the next 2 weeks, it is very likely that we're going to be seeing that vaccine for the 5 to 11-year-olds, which will be Pfizer. That's who has submitted right now for that approval. So it's very likely, we're expecting by the middle of November. So we have been in communication with the state with regard to, being able to, start getting ourselves in line, I guess, in order to be able to secure vaccine when it is approved, or assuming that it is. So the processes are in place to be able to make that happen pretty quickly. The other thing, though, to keep in mind is that even when we get to the point where CDC says, yes, we're going to approve this, we've approved it, and these are the parameters, until they get those documents, those written directives posted on their website and made available, those are really necessary in order for us to be able to move forward with our standing orders with our medical director. So sometimes people wonder, okay, well, they said on the news that it's ready to go, and so they wonder why we're not doing it yet. But there's a process that has to be followed, and we have to make sure that those written directives are in place and are signed.
That's great. That's great.
Yeah, so soon, very soon. It's something that all of us are looking forward to.
Yes, I think the children are too, so they can get together more frequently. So if we have no other questions, okay, we have another question.
I had a question about what groups would be suggested for the boosters
So go ahead.
and local testing sites.
All right, so I will handle testing first. So if you go to the health department website or go to the county website and click on the big box that says COVID, there's a whole list of tabs there that you can choose from, and one of them is testing information. We actually have quite a bit of testing opportunity here in Lenawee County. We have at least 2 of the pharmacies here in Adrian, and at least one in Tecumseh that does testing. The county has the testing that we do on Wednesdays and Fridays. And we've just recently increased our capacity there, and not only increased capacity as far as numbers that we can test in a day, but we also are doing rapid antigen and PCR testing at that facility. So that's a great service for the community. Adrian Public Schools has also been just a really great partner and has been doing the testing, that same testing model on Sundays there at the high school.
Yes,
And I don't know if they have one scheduled for this week yet or not. But that's something they've been doing for the last several weeks, which is really helpful to have that Sunday option for families to be able to utilize. And then as far as the boosters, so CDC has approved boosters for all three of the vaccines that are approved here in the US. I believe that and again, this goes back to that, having those written directives in place, which there's still a couple of the documents that they have yet to update. But I would expect it to be very similar to what is in place for Pfizer, which I believe is 65 and older, and then individuals 18 and older that are living in a long-term care setting, and then individuals that are 18 and older that have health concerns or underlying conditions that would make them more susceptible to severe disease from COVID. And then also individuals that are that work in a high risk occupation. So that information is available on our website for the Pfizer, and will be updated soon for Moderna and the Johnson & Johnson.
Excellent. Anyone else? I'd like to open it up to questions for those that are online. If you have any questions for public comment, you can speak at this time for our Health Department Director, Martha Hall. Okay, I'm hearing none. So we just like to thank you so much for your time and energy. I know you're on a tight schedule, and I really do appreciate you taking the time to give us so much information. And we just like to invite you to be a part of our town hall meeting next month. So we will be getting in touch with you, me or the mayor, to see if we can get some more information out to the public during that time. So if you have to leave, we just want to say thank you so much for being with us and giving us great information.
Thank you. I really appreciate you inviting me. And the one thing that I neglected to say that I wanted to make sure that I did share, we are doing flu vaccinations. We're doing flu clinics every Tuesday. We did those. We've got just one, well, actually, I guess today would have been the last one for October. It just, the time is flying. I don't think I'm the only one experiencing this, this time travel that we've got going on. But so we've been doing them on Tuesdays. We're going to continue that at least into the first 2 weeks of November. So if someone needs their flu vaccination, they can call and schedule an appointment, and I can give you that number if you would like that.
Yes, please.
If they call 264-5226 option 2, they can get them scheduled for a flu vaccination. And then we do COVID vaccinations Monday through Friday from 8 to 11:30, and then 1 o'clock to 3:30 Monday through Friday.
Say that time again. For the
8,
COVID.
yeah, for the COVID, it's 8 to 11:30 and 1 to 3:30 Monday through Friday.
That's excellent. I know you have, if you have someone's email address, I know I've been getting updates every time you have an update. I've been getting it. So I do appreciate that. So anyone that would like to send their email to you or to your department or ask for it, they can get an update on what's going on in Lenawee County. But I do appreciate it so very much.
Well, I'm glad that it's helpful.
Oh, it's great, great help to me. It keeps me from calling you all the time. But again, we'd like to say thank you so much for participating tonight. And we look forward to having you with us next month if you can. But I will be contacting you and me or the mayor will be talking to you about possibly having you or a couple of people from your department to come and be a part of it as well. So
That
thank
would
you
be
so
great.
much.
All right.
All
Thank
right.
you.
All right. God
Have
bless
a
you.
thank you. Have a wonderful evening.
You too. All right. At this time, we have with us as well is a community action director, and I'm going to have the mayor to introduce him.
Hello, Clint. This is Clint Brugger, and he's going to be presenting on Community Action Agency. I did send this out to all of you today because Clint had shared it with me just so that you could take a look at it ahead of time. But we're going to give you screen share ability, Clint, so that you can go ahead and share that and present. And just one side note before you begin, Elizabeth had reached out to me today about everybody for the town hall. And she thought you were planning on it, but you were the one that we were going to be asking on that as well. But I told her you were presenting tonight so we could ask you that when you were here. So.
All right. So yes, I will participate in the town hall. We'll start there. And good
Thank you.
evening. Good evening to all of you. I am happy to have the opportunity to present about Community Action Agency. Let me real quick make sure that I'm picking the right screen to share. Are you all able to see that?
Yes.
All right. Let me get it back on my screen. Okay. So again, my name is Clint Brugger. I'm the Director of Training and Outreach at Community Action Agency. I've been with the organization almost 5 years. I had started in working in Hillsdale County as we cover Hillsdale, Jackson, and Lenawee. I had started out in the agency working for the Head Start program over there. Had moved into a role as the county manager for both Hillsdale and Lenawee counties. And then in November of last year, I moved into a position as the Director of Training and Outreach. And so all of the things I did as as county manager, I still do. I just, with promotions, you just get more to do. So that's kind of a little bit about me. And I am just going to start with talking about our mission. I think that's an important starting point. At Community Action, we take a local approach to identifying the causes and conditions of poverty to improve self-sufficiency through programming, advocacy, and leadership. As you can see, our mission isn't short and sweet and can fit on a t-shirt. So I want to take a second to just explain a couple pieces of it. And it starts with that first statement that we are taking a local approach to identifying the causes and conditions of poverty. And that local approach is what I want to call your attention to. As I mentioned, we cover 3 counties, Hillsdale, Jackson, and Lenawee. And I'm sure you can imagine that there are differences in how poverty shows itself in all 3 of those communities. In the city of Jackson, you have some more what would be considered urban poverty, whereas in very rural Hillsdale, poverty looks different. It doesn't mean that it doesn't exist, it just looks different. And so when we are talking about our mission, it's important that we are looking at it at the local level, because we certainly wouldn't tackle the poverty that you find in rural communities the same way that we would for those residents in cities, or especially in a place like the city of Jackson, for example. the second piece of our mission is that we are looking to improve self-sufficiency. I like to give an analogy for what that means. At Community Action Agency, we're not the place that you go to when you're hungry to get a fish. I'm not saying that we wouldn't help you find the fish. We certainly would. But self-sufficiency is more than that. We want to be able to help you learn to fish. We might teach you what kind of rod to use, what kind of bait would be used to fish in whatever pond that you're going to. We might even take you out to the pond and mentor you through the process. And then when we're all said and done, we want to help you learn to clean the fish and cook the fish, because if you don't do those things, you can't eat the fish. And so self-sufficiency to me and our organization is just that, teaching people how to catch and then eat the fish. That's self-sufficiency. And how do we do that? We do it through programming, we do it through advocacy, and through leadership. A real quick, just a brief history, because I'm not sure that many are aware of the community action movement and where it started. So I'm going to take you back in time to the Kennedy years. JFK was a huge proponent of looking at trying to solve poverty at the national level. And during his administration, there was a project called the Grays Area Project. And they really did take this local approach to seeking out how to identify the causes and conditions of poverty and then battle it. In November of 1963, JFK was assassinated, and then LBJ took over as president. So November, that happened. In January of 1964, Johnson declared at the State of the Union address in a joint session of Congress, he declared an unconditional war on poverty. Later in 1964, I think it was July, the Civil Rights Act was passed unanimously through Congress. And then a few months later, the Economic Opportunity Act of 1964 was passed. And that is where community action agencies actually began in our country. So I don't know if you're all aware, but there are community action agencies across our country. There are over 1,100 of them, covering all 50 states. And again, they look very different because all of them are charged with this local approach to fighting the war on poverty. So that's where we got our start. As a result of those early programs, as a result of the Economic Opportunity Act, other programs kind of developed from a grassroots level through community action. For example, the foster grandparents program, many senior centers, family medical centers, legal assistance, Head Start, early Head Start, lots of programs that now have their own federal funding, and they don't really necessarily go through community action agencies, but they were all birthed through the community action movement. So lots of other things happened politically throughout time, and things have evolved and changed and whatnot. But ultimately, our role in communities has stayed the same, to continue to fight the war on poverty. So with all of that, I'm just going to take a few minutes to talk about the programs that we have at our agency here in Lenawee County. If I can, there we go. So we are a certified local housing counseling agency through HUD, and housing counselors are certified through MISHDA and NeighborWorks Training Institute. Our counselors can give advice on buying a home, renting, default, foreclosure avoidance, credit issues, reverse mortgages, budgeting, home repair options, all sorts of things when it comes to housing issues. I made sure to print you all off a copy of these slides so that you could reference back if you ever want to know who's eligible or how you get in touch with our staff. We are currently open, so you don't have to just call the office. You can stop in. We're open Monday through Friday, 8 to 5. But calling is just as easy to be able to schedule appointments. So we do housing counseling. We also do foreclosure prevention counseling. Again, certified through HUD and the state of Michigan to provide free foreclosure intervention to residents of this county. We're dedicated to helping homeowners understand what options are available based on their own personal situation or need. And then we help them develop a plan to resolve their housing crisis, connect them with community resources. Again, they can call the office or stop in, leave a message, and we will get back to them as soon as we can. We also operate a supportive services for veterans family. Everything in the housing world, and I'm sure Elizabeth Salerno can attest to this, everything in the housing world has to have an acronym. So for this particular program, we refer to it as the SSVF program. And it works to help homeless or near homeless vets, both individuals and families, get access to housing and services. The goal of the program is to promote housing stability among very low income veteran families who reside in or are transitioning into permanent housing. To be eligible, you have to be a veteran or a member of a family in which the head of household or the spouse of the head of household is a vet. They have to be a veteran who's not dishonorably discharged, have a household median income not exceeding 50% of AMI, and they have to be homeless or at imminent risk of homelessness, according to HUD guidelines, which means that they have to be living in a place not meant for human habitation, such as a camper or the park or their car, or a shelter would be included in that. What's not included is doubling up with a family member. That is not a HUD definition for homelessness, even though they might, that family may consider themselves to be homeless. If they're doubled up with family or friends, they would not be eligible for this particular program. However, that imminent risk of homelessness, if the family member or friend that they were doubled up with were to draft a letter that said they had, 2 weeks before they had to get out of the home, that puts them at imminent risk of homelessness. And then that would make them be able to be qualified for intake. We also do the Volunteer Income Tax Assistance Program, commonly known as VITA. We can provide free federal, state, and city income tax preparation through IRS-sponsored Volunteer Income Tax Assistance Program. We train volunteers through the IRS to complete forms and then e-file them. Tax preparers work with clients to ensure that they're getting all of their entitled benefits. And again, the returns are electronically filed to speed up the receipt of refund. We can also do refund or returns for prior years. So if you didn't do one last year or the year prior to that, we would be able to get you caught up for all 3 years. They have not yet given guidance for the upcoming tax season on what the household income will be. However, I can tell you that last year it was a household income of $57,000 or less in order to be eligible to participate and get your taxes prepared for free through us. In addition, let me just go back. In addition, each year we've kind of struggled in the last couple of years because of COVID with how we do these tax appointments. So last year they were a by appointment only, and you dropped off your forms and then we completed and prepared the taxes and then met back up with the individual or family to review them and have them sign them so that we can electronically file. My guess is that's what we're going to be doing again this year, but I can't say that with 100% certainty, as we're really doing some capacity building right now as the tax season doesn't start for another couple of months. However, we are always looking for volunteers. We will begin the orientation process in November for new volunteer income tax preparers. So if you know of anybody that would like to give back to community, certainly share my name and my number, and I can get them hooked up as a VITA volunteer, and that would be fantastic. We also do a lead hazard control program. We were awarded a grant through DHHS to expand residential lead hazard control services to eligible households with Medicaid enrolled children in Lenawee. Most of our referrals come from the health department when they do blood screenings, also through our WIC office and Head Start and Early Head Start, as they also required lead testing for those programs through Adrian Public Schools. So most of those referrals come to us that there is a child in the home that has an elevated lead level. We make contact with them. Families have to have Medicaid enrolled children who are 19 years and under, or enrolled women who are pregnant. They have to reside in Lenawee, but home ownership is not required. However, participation from the landlord would be. So the landlord has to agree to have the house abated. What we do is we conduct lead investigations to determine if lead-based paint hazards exist. If a hazard's found, we control the hazard through various home repairs. If a home was built before 1978, families could really be at risk, as lead paint and lead pipes were used frequently back during those times. If people are interested in learning more or think that they may have lead contamination in their house, they can call the number on the screen or contact Natalie at that email address. You might be wondering, how does lead abatement, what does that have to do with identifying causes and conditions of poverty in a community? Well, if you think about getting a great start in life, a child who's being poisoned by lead isn't going to be able to likely be self-sufficient and catch their own fish later in life. So it really does meet our mission. It's just that our programs we have many different faces to how we identify causes and conditions of poverty and how we battle those. And this is one of them. We also operate a weatherization program that provides free home energy conservation services to low-income homeowners and renters in all three of our communities. Since 1976, we have weatherized over 7,600 homes in all three counties. What I can tell you is that the weatherization program is not a home repair program. Oftentimes people think it is. The home has to be in livable condition in order to be weatherized. So we're not coming in and replacing all your windows or putting on a new roof. But what we can do is make sure that the windows are sealed or that there's adequate insulation underneath the roof. But we can't come fix a hole in your roof. That's home repair and not weatherization. Here's a list of all the different kinds of things that this program can offer. And to schedule an appointment, we need to complete a weatherization program application. And the inspector then comes out to the home to see if the home is eligible, meaning that it's in good repair. Upon completion of the work, a post inspector comes to evaluate the weatherization measures installed and to make sure that we're satisfied with the work. Again, dial our number, leave a phone message, and her name is Misty. She will return your call and schedule an appointment for intake. We also do emergency services. We provide assistance for relocation, home ownership services, limited heat and utilities, and referrals for household contents or needs. Funding is very dependent upon local contribution to an unmet needs fund. Partnerships with 100 Women of Lenawee and several faith-based organizations have improved our capacity to assist. In the past, we have been able to assist people with all sorts of things. For example, to get into a housing program if you're homeless, it requires that you have some sort of identification. So if you don't have the money to pay for your ID, this unmet needs fund could do that. Say you're starting a new job and you need steel toe work boots. This unmet needs fund could purchase those for you. Again, it's only as good as the money that we have in the pot, and that is highly dependent upon local contribution. So sometimes we have the ability to assist lots of folks, and then there's other times when the cupboard is bare and we have to turn people away. So if you know of individuals that are interested in donating to a fund that can provide people with needs that they can't find elsewhere, visit our website. There's a donate now button, and there's a drop down menu that will allow you to put money into an unmet need specific to Lenawee County. Or if your church, oftentimes people church hop when they're looking for utility assistance or other types of things like this. Many of the churches have given their benevolence funding to us to manage because we have an intake process. We know that people aren't coming in multiple times for the same need when the need has already been met. So just some things to keep in mind. Eligibility is typically determined by declaration of need. So the person just has to say, I need it. We also work with DHHS. So if somebody has a shut off notice, we would contact Consumers Energy, put a hold on the account, and then encourage that person to complete a Michigan Bridges application, specifically the state emergency relief section of that, to see if the state would provide before we get into our unmet needs fund, because they're limited. So this time of year, it's the new fiscal year for DHHS. So anybody that would be coming now, we would refer to them because it's a new year. So folks would be able to apply through them first. If people are looking for assistance with all of that, we can help navigate through the Michigan Bridges portal. And they can contact our office, leave a message, and someone will get back to them. We are also partnering with Housing Help of Lenawee for the COVID Emergency Rental Assistance Program. The acronym here is SARA. So this particular assistance is for tenants or landlords who are behind on their rent or potentially behind as a result of, what's it say here? As a result of a COVID, I'm trying to figure out where it says on here. Here it is. Renters who have incomes less than 80% of the area AMI, who meet the following conditions. The household is qualified for unemployment benefits or has experienced a reduction in household income, incurred significant cost, or has experienced other financial hardship due directly or indirectly to the coronavirus outbreak. Individuals in the household can demonstrate a risk of experiencing homelessness or housing instability evidenced by a past due utility or rent notice. So the way that we're partnering with Housing Help, all applications go through this portal at this website that's on the screen. So that's the first stop for folks, is completing that application. It then goes to Housing Help. We're doing the utilities portion of that. So they'll make the referral over to us that somebody is in need of their water bill being paid or their light bill, those types of things. And then we can work with Housing Help to get those met. Housing Help is doing the rental portion of all of that. The county was awarded $3 million or so. I can't remember the exact number. We don't want to return money. So if you know of people who are struggling to make ends meet, they have to be renters who have experienced financial hardship as a result of COVID. Have them visit the saraapp.michigan.gov website to complete an application. I do want to let you all know that a major block for some folks has been that the application requires a valid email address for the landlord. And if you don't have that and it's not verifiable, you can't move forward in the application process. So folks have to have a valid email address for their landlord in order to participate. We operate financial literacy and education programs. We recently given these a facelift, and they now have, oh, I'm hearing an echo. Okay. So we have recently given our financial literacy and education courses a facelift, and they now have topics related to the time of year and need. For example, in November, we have a course called How to Budget for the Holidays, and other courses set up through the year. For example, in the new year, I think the course is called New Year, New You, really helping people to understand how to save and budget and prepare themselves for a new financial future moving forward. In addition to the financial literacy courses, we do have a Rent for Success course that is aimed at helping tenants learn their rights as tenants, learn landlord rights, and essentially be a good renter. Currently, for those residents of Lenawee County who participate in that course, there's a $50 stipend that they can get through the Lenawee Financial Stability Coalition. So you can actually get paid for taking the Rent for Success course right now. We also provide home buyers education and other classes. We also, a couple times a year, we sponsor a Getting Ahead in a Just Getting By World class based on that book. The goal is to provide a learning environment and experience where adults can examine their lives, investigate new information critical to addressing poverty issues, assess personal and other resources, and then discover how to help solve community problems. It's a 12-week course, really looking at bettering the whole person. For those that successfully complete all 12 weeks of that course, at the end, there's a $300 stipend that they can use to help themselves get ahead. We also operate a migrant outreach service in the summer. We partner with the University of Michigan to provide weekly health clinics out at the migrant farms. Oftentimes, these folks are underserved, and so we really do provide an excellent service. As you can see by this slide, in the past, we have had 112 doctor patient. I think this was 2020's numbers. 2021's haven't come out yet, but 112 doctor patient visits, 76 prescriptions, 5 x-rays, 4 lab tests, 9 pair of glasses, 8 dental visits worth more than $40,000 to the migrant population here in Lenawee County. So it's an awesome service that we look forward to providing each year. And then what I think we're most known for is the WIC clinic. I saved this for last because I think oftentimes people equate Community Action Agency as the WIC office. And as you can see by this presentation, we do a lot more than just offer nutritional support for women, infants, and children. The WIC program really helps pregnant moms and babies up to the age of 3 get a better start nutritionally in life. In addition to nutritional instruction and courses and making sure that the babies are meeting milestones, we also can provide food assistance, healthy food options for pregnant mothers or postpartum mothers, and then formula for families that aren't breastfeeding. We also provide breastfeeding counseling, breastfeeding support for individuals as well. So who's eligible? Pregnant and postpartum women, infants and children up to age of 5. They have to be residents of Michigan from low to middle income houses, so 185% of federal poverty guidelines, and or Medicaid or food stamp eligible, and are determined to be nutritional or health risk by the Community Action WIC staff. In Lenawee County only. I put this other information on because sometimes I give this to our own staff. But I welcome any questions that you might have. As you can see on this last slide, I've got contact information, and I welcome any of you at any time that you might have questions for me to reach out. I'd be more than happy to meet with you, to share any information that I have to help connect with other community resources, anything that I can do to help folks out. So I'll take questions if you all have any.
I think you covered quite a bit. And we are just so excited about the fact that you have taken your time to come and give us such positive information. But there's a lot of people that have been asking a question about the renters part.
Mhm.
I know that you say that you partner with Housing Help.
Yes.
Is there another agency that you're working with? And what are some of the problems with getting through to these agencies that I see people are not getting it, all the help that they need? And you have this money and we'd like to help spend it for you.
Yeah, of course. So I think that the biggest problem right now is the capacity to serve. With most things, funding that comes from the federal government, they gave us approximately 15 seconds to prepare. So we had to do some
Mhm.
capacity building in order to, have staffing and whatnot to actually perform the obligations of spending the money. I think Elizabeth's on the line. I'm sure she can attest to the fact that some of the delay was making sure that we got staff hired on, got staff trained how to do it, which takes some time. And also from Mishta's end of things, there was some holdup with them getting the portal to a point where it was working sufficiently. And then I think it's just now weeding through prioritizing folks. So folks that are facing eviction would be prioritized. And I think a lot of times people don't understand why they've had to wait so long is because we want to get to the folks prior to eviction and help them first, so as
Mhm.
to prevent them from becoming homeless. And so others that are waiting on that kind of get bumped down the list because they're not facing imminent risk of homelessness that somebody who's in the courts would be. So I think that's the other component of it. Elizabeth, feel free to jump in and help me answer this question. I think
you answered it, but I would like to hear from her. We're so glad to have you back with us again this month. But please share some of the information you'd like to share. We have about 10 more minutes before we have to close out. So we just want to thank you so much for coming back and sharing. And we're looking forward to you all participating in the town hall meeting.
Like Clint was saying, is with the ceremony it was always the money's coming, so hurry up and wait, but then you didn't get the direction you needed. So, but I will say part of the initial hang up had to do with they want people to apply online, but they had to start the program a month or two before they actually had their system up and running. So then we had to do everything through paper applications. Then we had to enter all the paper applications. Like they gave it to us and said, enter all your paper applications for an entire month in 1 week while still processing new applications. So that's unfortunately just kind of how things tend to work sometimes with the government funding that we get. Another thing though, is part of our issue in our community for spending money right now, like maybe not helping people as fast as we would like, comes down to the fact that there's the literally homeless population. There aren't units that we can put them in. So we're struggling to get people in housing as fast as we would like. We have plenty of people, they're following through. We have everything we need. We just don't have an apartment to put them in. So that's the other end of it. When people are saying, I'm not getting helped fast enough, that's part of our issue is we're trying to find landlords that have space available. The upside for having programs like Sarah that can help you before you get evicted is that we're keeping people housed. However, our community is used to that turnover, unfortunately. So it's that really weird problem to have. We never have enough housing, but it's even more so when aren't these evictions happening. There's no units opening up. And then as soon as they open, you have 100 people applying within 1 day. So that's a big struggle that we're having, spending the funds. But right now we're getting people in and out probably within just a couple of weeks at the most. And you can apply without an email address, but that means you're doing a paper application, and then our office is actually inputting everything in for you. So it is, if you have an email address, the process can obviously be a lot easier and simpler. However, there is a process in place for those who don't.
Okay, well, we would like to open it up to community and public comments. If there's anyone online that would like to speak before our time is up, we have about 5 more minutes that we can speak on that before we let the commissioners speak. Well, hearing no comments, then we're going to say to our commissioners, is there anyone that would like to offer a question to our community action agency or our housing help person that's present with us? No questions? Mayor?
I just want to say thank you so much. That was extremely enlightening and very helpful to really, even though I've served on several things with you, Clint, I didn't actually really know what Community Action Agency was doing until I received these slides and then, heard the presentation tonight. And I just feel like it was very helpful information, and it will be very helpful when we can share that with our entire community and really get that word out, so that more people are aware of what you are offering. And it's just great. And thank you very much.
Yeah, no, I thank you for the opportunity. And, I'm certainly not a person that is afraid to speak. So anytime
No.
that you're looking for somebody to fill a few minutes, I'm your guy. I appreciate the opportunity.
Well, we appreciate it. And maybe what we will have to do in the future is have you deal with one area and give us as much information as people are needing. Say like the WIC program, because I'd like the families to know more about the WIC program, because a lot of people are not utilizing it, and that's an easier one to apply for if you have a new birth or you're pregnant or having some of those issues. That's a lot easier to get to and get some support and help. And we also like to thank our Commissioner Boone, because he's opened up a new avenue for a lot of people to get food. So we just want to applaud him for the services that he renders here in our community. With the open house happening last month, we just appreciate so much of what has happened and what is going to be happening in our community. So we'd like to thank both of you for participating. And if you want to stay on, we will have another meeting at 7. If you'd like to give some more comments, we can do that at the 7 o'clock time. So if not, if there's no other, yes, all right. Commissioner
I
Frank?
just wanted to ask if it would be okay if we attach that PowerPoint to like the meeting notes. That way all that information is available, because the meeting notes go on the website and then all of that would be available right there.
Absolutely. Yep.
Okay, so if you would forward that to,
We already have it.
okay.
They all have.
I
it.
was gonna say we have it, but she's talking about to the community, right?
Yeah, but she can do that. She can
Yes, you
attach
can
it to
forward
that,
it.
so,
You can
yep.
forward it.
Yep.
Okay, great. Thank you, Mayor. We appreciate that. And we'd like to thank you so much. And I'm glad you kept talking, because you gave so much information and so much help, especially with the PowerPoints. They were outstanding this evening. So thank you again for participating, and we will be contacting you about the town hall meeting and exactly how much time you will have and what we are going to be doing for November the 18th. Put that on your schedule at 6 p.m. Okay? All
I
right.
have
Thank
it
you
on my
so
calendar
much,
and I
both
look
of
forward
you.
to it. Thank you.
All right. Okay. All right. At this time, we have to finalize, we'd like to open up for public comments. If there are no other items that we need to do. Hearing none, then we'll open it up for commissioner comments. Do any of the commissioners have any comments that they'd like to make at this time? Mayor, do you have any comments that you'd like to make? Well, I'd like to make one, and that is I'm so very proud of the two groups that came to speak to us tonight, the Lenawee County Health Department and also the Community Action Agency, along with Housing Help. All of it has been very rewarding, and I'm so glad that they were able to participate. So at this time, I will take a motion to adjourn.
I motion to adjourn the pre-meeting.
Have a second?
I second it.
All in favor? All in favor?
Aye.
Okay, so we will turn off and then we'll be back at 7. Good evening, everyone. This is a regular meeting of the Human Relations Commission for the City of Adrian. Our meeting sessions are public and you are able to speak when we are at the public comments. At this time, we will stand for the Pledge of Allegiance and a moment of silence, and then the roll call. Let's stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call, please.
Mayor Ortiz,
Here, present?
Commissioner Bernard,
Present.
Commissioner Ramos,
Present.
Commissioner Patton. Oh, just left. Commissioner Cavazos Frank, present. Commissioner Boone,
Present.
Commissioner Dillon, Barron,
Present.
Commissioner Carter, Commissioner Harvat.
Present.
All right, I need a motion to excuse the absence of Christopher Carter, Commissioner, and also Lindsay Patton. And at this time,
I motion to excuse Lindsay Patton and Chris Carter.
I second.
roll call, please.
Mayor Ortiz,
Yes.
Commissioner Bernard,
Yes.
Commissioner Patton, or Commissioner Ramos,
Yes.
Commissioner Cavazos Frank, yes. Commissioner Boone,
Yes.
Commissioner Barron,
Yes.
Commissioner Harvat.
Yes.
All right, unanimous. At this time, the minutes, I need approval for the pre-meeting minutes for September 28th, 2021. Motion, please.
I motion to approve the pre-meeting minutes for September 28th.
Second,
Second?
roll call, please.
Mayor Ortiz,
Yes.
Commissioner Bernard,
Yes.
Commissioner Ramos,
Yes.
Commissioner Cavazos Frank, yes. Commissioner Boone,
Yes.
Commissioner Barron,
Yes.
Commissioner Harvat.
Yes.
Approval of the regular meeting minutes for September 28th, 2021. Need a motion, please?
I motion to approve the regular meeting minutes of September 28th.
Second,
A second.
roll call, please.
Mayor Ortiz,
Yes.
Commissioner Bernard,
Yes.
Commissioner Ramos,
Yes.
Commissioner Cavazos Frank, yes. Commissioner Boone,
Yes.
Commissioner Barron,
Yes.
Commissioner Harvat.
Yes.
All right. Are there any additions to the regular agenda for tonight? Hearing none. Are there any changes to the agenda that we would like? Hearing none. Approval of the regular minute agenda. I need a motion, please.
I move to approve the regular meeting agenda.
I second the motion.
Roll call, please.
Mayor Sortie,
Yes.
Commissioner Bernard,
Yes.
Commissioner Ramos,
Yes.
Commissioner Cavazos Frank, yes, Commissioner Boone,
Yes.
Commissioner Barron,
Yes.
Commissioner Harvat.
Yes.
Unanimous vote. All right, we're on our old business at this time. And our current mission tonight is to finalize everything for the town hall meeting for Thursday, November the 18th, 2021 at 6 p.m. So at this time, I'd like to thank the mayor for getting the Community Action Agency to participate in the town hall meeting. So they have agreed. We also had Lenawee Community Health Department that has agreed to participate. And also the coalition, is it?
Well, so she sent some, so the email that I sent out today, it states in there that they received confirmation from Catherine Cobb,
Catherine Cobb. Okay.
Legal Services of South Central Michigan, Share the Warmth, Community Mental Health, Continuum of Care, and Housing Help of Lenawee.
Excellent.
And so then Community Action Agency obviously is in addition to that. It's because we've just confirmed that.
And the health department.
And the health department, sorry. Yep.
Okay, so that's about 8 to 10 agencies that will be speaking. So what I would like to see us do and have discussion about that, and is each one of us take one of the agencies and we would walk by introducing them. And also we would walk through the questions for anyone in the community or anyone on the panel, so that one person is not doing all of it. So,
And the one thing to keep in mind though, too, is that continuum of care is going to be a little overlap with some of this because continuum of care does involve a lot of these, but
mhm,
I still think it's crucial that both Housing Help of Lenawee, even though it's Elizabeth that's chairing continuum of care as well, that I feel they should be separated, even though continuum of care does encompass all of those, just because I think people need to know what they do together as continuum of care, and then also what Housing Help of Lenawee does separate, but just clarify that. So that
so.
it'll probably be Elizabeth speaking both times when we're asking that, but I feel they should be stay separate.
So you want her to present specifically for the housing help and then separately at the end. So then what we should probably do is have her finish after each of the agencies has spoken their portion, and then she will speak at the end. Is that where you want to go? Okay. All right. So who would like to take which agency? That's what I would like to see right now. We had them
Well,
under.
I guess one
proposed.
question I have is how do we want to formulate these questions? Like, I know that the email I sent out to all of you today from Elizabeth, she just said that we can use this information, to help us come up with questions, but how do we want to come up with those questions? Like, do we want, I don't know. I don't know where to go from there. I don't know if it's, something where we just all contribute in, or is this somehow, some way we can get this to the public and get questions from them? I don't know where to go. I'm not going to lie, but that's one of the questions I had, I guess, in my mind, even after getting the email today, is how do we as a group come up with these questions?
I think we had talked about at one of the previous meetings, maybe it was the last one with, when they were both here, about talking about someone entering the process. Like, what are questions there? And then each step, like
Mhm.
what agency would they go to first? And then who would help next? And just kind of like work down that chain that way. And then maybe we can come up with questions if we we could probably talk to Elizabeth about like where someone would go first. And then what questions people might have there. And then at the next agency, if they needed help with this, where would they go next? Kind of a thing.
Okay, so my thinking is that we want each agency to give us their information, right?
Mhm.
Is that what we want? Okay, so if we do it like we did tonight, we don't have to come up with questions. Unless we have questions, or you get a question that you can ask, or we have someone online that has a question, that after each one speaks, then we get questions and answers then, instead of waiting till the end, because we're not going to have everybody stay on the whole time probably. So if we do it similar to how we did it tonight, have them make their presentation, give them so much time to do the presentation and so much time for question and answers. If there are none, then we go on and keep going with each agency, because you really want the information out there, right? So if we want the information out there, we really don't have to introduce any questions unless we have something that they didn't cover. For example, like tonight, Community Action Agency gave all the information. We didn't have any questions because he gave so much. So he may answer the questions while they're presenting. So we will want them to do that rather than interrupt them and ask the question, because that could throw them off onto something else, and then they'll be using up more time. So if you all would allow us to do it that way for this time and see how it goes, rather than introducing questions along the way. But each person, if you would introduce that group, and then you would, if there is any questions, we have that person do the question and answer for that group. Say like the Department of Aging, you would handle just that and then move on to the next one. Okay?
And
So,
my,
mhm.
you know, my one fear is that I'm just sitting here, I'm doing the math right now as I'm sitting here.
Mhm.
You know, even with 8 groups, just for them to present
Mhm.
and for there to be any time for questions, I mean, even if you were limiting them to 15 minutes, which is really fast,
Mhm.
we're not going to get, that's still 2 hours right there. And that is my only fear about all of this, just because it is so much all together, or is it okay that we're going to go like 2 hours instead of like an hour and a half, or, whatever we set that as. But I want them to have like ample time and like do a condensed version. Obviously Clint's not going to be able to do what he just did tonight
No.
because he wouldn't have that kind of time and still have time for questions. I do like where they can just ask questions, the public, or we might come up with them. I do like that aspect of it. And I really feel like we have to be really cognizant of, telling them we need your presentation to be this fast, but that we have to really hold steadfast that we're still going to allow this much time for questions, because we may have them, the public may have them.
Mhm.
We had some tonight. So I just want to make sure that in true town hall fashion, it's not just really them presenting, it is the questions. So like a very quick synopsis, and so maybe that's where you go with like, everybody taking on an agency or, whatever, reaching out and just saying, like Elizabeth did give us like a bunch of different presentations. She gave us community mental health. She gave us housing help of Lenawee. She gave us, continuum of care. She gave us a bunch of stuff today, but, telling them like, we don't want you to feel cut out, but try to give us the most condensed version and the quickest version you can get so that we can get a lot of info out. But like, we do want people to know, but yet we want to give time for those questions too. And that's going to be the hard thing to do with this, with having so many groups, which I think is great. And we want to really get that out. And a lot of them fall under continuum of care anyways. So that's also good. And we can say, hey, this is a group that's kind of bringing all of these groups together, the majority of them, but I don't know. So that's only my only fear is that right now.
And I think we're going to have those questions and concerns the whole time. However, if we say, okay, give us a presentation that is between 7 and 10 minutes. Okay, in 7 and 10 minutes, they could give us a lot of information. Okay. And then we have the question behind that. We say the questions are 7 minutes or 5 minutes, 5 to 7. If we do 5 to 7 minutes, so where are we? 5 to 7 minutes, 10 minutes. We're talking about a capsulation of time. So we don't have to be 2 hours, but if we go 2 hours, we're set to do that. But if the questions don't come, then we keep moving to the next group. And asked her, with the continuum care, asked her to outline for each of the agencies that's going to be talking. She knows what the bullet points should be. She knows exactly what is the target for this community, because that's the main thing. The target for this community is mostly what? Homelessness, losing your home, especially with winter coming on, being able to be sheltered. And you've got that shelter portion coming for information if someone needs sheltering. And just like her major problem right now is housing. Housing and development. What is it that we need to do to help with the housing? Maybe we know someone that's about to sell their house and maybe they would rent it out instead of selling it right now to accommodate somebody for the winter. Or then you were talking about prenatal care and child care. So tell her that these are the agency's comments and questions that we need you to capsulize for us in a small space of time. And then if there's questions we can give it to them and have them address it, or we can do it like we did tonight. Ask questions to them. And she was really open to, and so was he.
And I think a lot of times, not having pre-formulated questions is better anyways, because I think that's just my opinion, but I think a lot of times when you see a presentation, you're like, oh, well, I have a question about that now that I just saw that, or that just hit me different, or when they give that presentation. And the public, would feel the same way, but I feel like that's how I am a lot of times when I'm presented with something. I'm like, oh, well, I see that a little differently now. That's my thought.
And then we remember that we had someone have that situation that we know about, then we can ask that question, So are we in agreement then that we give them so much time to present, and then the person that is presenting them at the event, one of the commissioners, then we will utilize the question and answer session behind each one. Is that how we want to do it?
I
Okay.
like that. And I like doing the question as you get the presentation, because
Yes.
otherwise none of us will remember by the end, or
Okay.
nor would the public.
Okay. All right. So which agency would you all like to do? And I'm going to ask the mayor before you all decide. I would like to ask the mayor if she would do the continuum of care. So that follow up, and any questions that we have at the end after Elizabeth speaks, then the mayor will take over that portion of it, because that will encapsulate all of them that she deals with. And that's the majority of what we have. Okay. All right. So tell me what you would like to do.
I just have a comment.
Yes, ma'am.
I think it would be good to have a focus for them. I mean, I'm fine with them presenting,
Mhm.
but I think they need to focus so that maybe in preparing, we ask them, what is the principal mission and value of your agency? And how do you carry it out, or something like that, so that they come at it in a way that's specifically focused for us to understand. Because otherwise, I think it's going to be so condensed, it might be all over the board. But if they can put their energy into a couple specific questions, what do you do? Why do you exist? And how do you do your purpose in your life?
And how helpful you are to this community,
Mhm,
because that's our main goal.
Mhm.
Are you helping this community?
right.
Like I can say for the food pantry, I know what it's doing, because people are hungry, people have needs. And so that is going to be a great asset to this community.
Mhm.
So I agree with you. So if you take an agency, then you talk to them and you give them that we want that mission and purpose, right? mission and purpose.
Well, I like Sister Pat just said, I think the what, why, and how are perfect. Like, that's a really good, I agree. That's just very good. It's right to the point. It's exactly what we're wanting. And that gives them a much easier scope to work with on what they need to present on as well.
Mhm. Okay, so agencies now.
I can take the mental health.
Mental health,
And Madeline DeMarco is the one that's with the continuum of care and stuff, and she's been the one probably most active. So there's other ones on there, but that might
Okay.
be a good one to start with.
okay. Next, who would like to go with? Take one. Well, you tell me which one. Okay. Community Action Agency, okay. So housing help, okay. Commissioner Frank,
I can do Catherine Cobb.
okay. So was it two shelters who's coming?
Share the warmth and Catherine.
Share the warmth, can you do both of those?
I can do share the warmth if you want. That's Kelly.
Okay.
Kessler. She's a city commissioner.
Okay,
Other two of them, I'm fine with that.
okay. So. Okay, what's left? What's left?
Because I don't.
The health department, the.
The health
legal aid.
department, you want to do, she was here tonight,
Sure, I can do.
health department,
And then do you want to do legal aid?
I could do.
That was not presented last time. Yeah, because we're not allowed.
Okay, so whatever is left over, the mayor and I will do, okay? And we have, oh, Lindsay, if Lindsay wants to do one, but we still will have it recorded, so we don't have to take minutes. Now, the other question that I have is, are we going to do the combination of us being present here in the chamber and they be on Zoom, the agencies? Because some have asked me about being able to be on Zoom.
I think considering what Martha said, that we should still be avoiding group settings. I think it should remain on Zoom.
She made it clear. Mhm.
Yeah, and I think it's a good option because I think a lot of these groups, like they work all day long and it's just easier for them to do it at night with us, you know, from their homes or
Yeah,
from
'cause she wasn't gonna
wherever.
be able to come if she.
Yeah,
couldn't do it
and
that
so
way.
I think, you know, but if somebody really feels passionately and wants to present here, that's completely fine because it wouldn't be adding too many, but I feel like to give that hybrid option, you know, and you'll get a lot better participation even in the town hall by keeping it in that option because our city commission meetings have never been probably more attended than they have since we've gone to the hybrid, both with in person and
Both.
on the screen.
Mhm.
It's really helped with the public participation and attendance. So I think that would help with our town hall attendance because many people are, you know, very nervous about those, you know, large situations. And so they'll probably feel better being on there, but then it's just another outlet to get all that information out. I feel any way we can get this information to the public,
Yeah.
whether they're in person or, you know, online.
And having it shareable afterwards, because I know I
Yep.
share our town halls on my Facebook page and a lot of people, either they work second shift or they work
Yes.
third shift and they're
Yes.
sleeping right now
Yes.
and or
Yes,
stuff like
and a
that.
lot
So-
more people are asking about
Mhm.
getting that information and it will
Yep.
be right there for them.
And that was part of my thing with keeping it watchable, because
Mhm.
people aren't going to sit down and watch a 2-hour YouTube video just to get the information they want. So
That's true.
something like that.
Exactly. Okay, all right, so then if we are going to do both, that means that we have to be present. If you cannot be present, please let me know. If you can be on Zoom, it's okay. You know, if you get quarantined again, because it's not going to count against us because it's not our regular meeting. So it's a town hall meeting, okay? All right, anything else? Lindsay would like to bring us a snack. for the town hall. So, and some water probably or something. We'll have something here. If you all would like something more than that, let me know and I can bring something that you all can have to eat while we're doing that, since we'll be here. Okay. All right. Any other questions or concerns?
And we're doing that town
comments?
hall at 6 PM,
At
correct?
6 PM.
Okay.
And we didn't put the close off time. I sent you the flyer as well. That was an overview and Ms. Dewey is going to make sure that we are doing it the right way, right? We appreciate her so much. She's given us so much assistance. All right, at this time, if there's no other prep or information that we would like to have, we just need to talk to Commissioner Ramos about the pre-meeting for next month. We're supposed to be having the Premier Bank. Is that correct?
Yes, I had talked to her recently. That should all be good.
Okay, so we don't need to add anyone else because we're going to have the town hall on the 18th. All the agencies that we have been dealing with are going to be doing that. And next year, when we do our next town hall, we're going to be doing Bridging the Divide again and other things. We'll be talking about what we will be accomplishing, right? Okay, so we will be having the next meeting. We voted to have the Premier Bank for November pre-meeting. And they can stay on they can come on and be part of the town hall in terms of being present, not to present though, right? We're not having them do any presentation during that, right? Okay. All right. So if there's no other questions or concerns about the town hall or the pre-meeting, then I'm going to open the session up to public comment. If there's anyone online that would like to speak at this time. Hearing no comments, I open it up to commissioner comments.
It might fit better as an announcement, but I just want to say that this Friday, A3 will be putting on Halloween get
Oh, that's
together.
under announcements.
I said it might fit better there,
Okay.
but it's too late. I'm already partway through it.
Okay, go
So
ahead.
That will be on Friday at 5 PM and we'll be at Parish Park. We'll be handing out candy. Feel free to come in person, like come as normal or in costume. I'll probably be in costume. And we'll be giving out candy. I think D'Angelo actually has some flyers here. And yeah, we welcome you to be there. If you want to pass out candy, we'll be happy to give you space to.
Okay,
And contact either myself or D'Angelo if you want to be a part of it.
all right. Any other comments or announcements? Mayor?
So another announcement is that this coming Saturday, October 30th, just to let you know, that's why we're decorated inside here. From 4:30 to 6:30, there will be trick or treating downtown for anybody that wants to come down. And at 6:30, there will be a Halloween movie shown in here. That's why they all have it decorated up as well. But there's going to be, there's
And
going to be
that's
a
on Saturday.
Saturday, there's going to be a DJ playing, music. There's going to be like a costume parade and just a lot of trick or treating throughout all the businesses and other people that are coming down to help and do some trick or treating and things like that. Yeah, so it'll be really fun and hopefully the weather holds up because when we did this 2 years ago, it poured. So let's hope that doesn't happen again. But yeah, so they have that opportunity Friday night, then they can come downtown Saturday. And then obviously regular city trick or treating is Sunday night. So our kids can all be hopped up on way too much sugar. But yeah, so there's 3 events right in a row, but just wanted to let you know.
Okay, so Friday night is the Parish Park. Saturday evening is downtown businesses and
Yep, at
movie,
4:30. Yep.
4:30 to 6:30. And the movie is at 6:30? And Sunday is Halloween. And so we're doing the Halloween at our church and just giving the candy out to our youth instead of having a trick or treat, because our other church is doing a movie time. And we're doing an outside movie and trunk a treat. So that means that they're doing it out their trunks. So we want to say thank you to everyone for that. And if there are no other announcements, I'm open for adjournment. Motion,
I motion to adjourn.
I second.
roll call? No, all consent.
Aye.
Aye.
Aye. The meeting is closed.